Hi, welcome to the DECA webinar series. Today we're talking about Cold Peel, the latest innovative revolutionizing technique for skin resurfacing. Skin resurfacing has been a very important technique throughout the CO2 use of lasers. There are some relevant dates in the history of skin resurfacing from 1991, when the first ablative CO2 full resurfacing technique was developed, to the non-ablative resurfacing in 96, up to the non-invasive resurfacing techniques in 2004, and lately the introduction of CO2 fractional resurfacing 1 to 2 years later with the endorsing of CO2 machines. The traditional fractional mechanism of actions includes the classic ablative that was mostly concerning horizontal ablation of biological tissue, up to the non-invasive fractional resurfacing that was about mostly perturbating a portion of collagen in the deep of the skin, up to adopt finally CO2 vertical columns of ablation in order to optimizing the skin tissue response and just to perform a sort of finest tuning of what it was the skin resurfacing process as a whole. In 2005, DECA invented Smartxide dot, and Smartxide dot was the first game-changer technology in CO2 developing lasers, because it was combining the best of both traditional resurfacing as well as the new fractional technology in order to offer to users variable control fractional ablation options throughout variable parameters and balance results with the downtime. This was the first attempt in which we were tailoring the treatment to the patients and not just adapting the patient to the treatment itself. Just a few years later, DECA introduced to the market a complete revolution. The first multidisciplinary unit endorsing a brand new technology called PSD, pulse shape design. This was the family of Smartxide Square and just a few years later, Smartxide Touch. This was the first introduction of the radiofrequency excited CO2 laser source with cosmetic radiofrequency function on top of the ablative scanner, extend a database of protocols, the possibility to have traditional and fractional resurfacing in one unit, and the outstanding possibility to include plug-and-play adapters in order to be shared among different departments of the same clinic. In fact, Smartxide 2 especially is actually more surgically oriented device and can be used from ENT settings up to surgical gynecology theaters, neuro department, dental, dermatology, plastic surgery, and cosmetic gynecology. In 2018, the Smartxide Punto or Smartxide Tetra in the United States was developed. The optimization of the PSD knowledge and technology from DECA saw the light in this new latest product that was including a breakthrough new mode of delivery called spray. Smartxide Punto, although small dimension and lightweight device, is actually endorsing the previous predecessor's technology as well as introducing the Cold Peel that is one of the top of the lunchtime laser treatment worldwide. It still endorses a radiofrequency excited CO2 laser source. It's still offering both traditional and fractional resurfacing options, and it offers a great optimization of results towards the downtime. In fact, with these units we can decide the downtime of our patients in order to decide how many days they might stay home before reprising their own social life. This is PSD, pulse shape design technology. It includes the possibility to select different pulse shape. When we talk about pulse shape, we talk about different emission features, different ablative selectiveness, different efficiency of treatments, different possibility to deal with side effect, and of course, depending on the selected pulse, we can reduce very practically the downtime. For dermatology and plastic surgery use, we're talking about mostly 3 pulses: smart pulse, deca pulse, and high pulse. Different waveforms, different ablation profiles, different thermal stimulating profiles. This is how each and every other pulse behaves in the human tissue. Smart pulse is actually more involving papillaris dermis, that is traditionally the part of our dermis that is full of capillary, very vascularized, very low water content compared to other regions of our skin that might have different kind of behavior from an erythema and edema standpoint. In fact, this is how smart pulse act in these of 2 regions. Deca pulse instead, it's a deeper pulse compared to smart pulse. In fact, the peak power is greater than the previous pulse I'm describing, and the ablative hole is actually able to touch reticularis dermis that is instead full of water, collagen, and elastin fibers. These lets the heating product by these pulse to be attracted in this region of the skin in reason of 70–80% in the reticularis dermis, leaving to from 20 to 30% in the papillaris dermis, and producing an incredible shrinkage of the collagen fibers, incredible shrinkage and development of the elastin fibers, and then to present an ablation to the touch that is definitely softer than compared to what we might have with smart pulse. Finally, H-pulse. It can be used mostly in 2 different ways. Very superficial one, I might say just emulating a Nerbium laser machine, or vice versa, like a sort of very deep and cold, I might say ultrapulse-like mode, still depending on the different parameters. Another very important features of Smartxide Punto is, as I mentioned previously, spray mode. Spray mode is apparently random algorithm that is actually allowing the dots to be randomly disposed within the ablation figures in order to eliminate any visual demarcation lines in the post-op phase, and then erasing that not pleasant effect to see different kind of squares throughout the entire tissue being treated. Spray mode is actually giving the patients the sensation to be submitted to lower heat during the treatment. This is very important, especially during the ablation and especially immediately after. Our brain understands only one language, that is pain, and in CO2 technique, pain is directly correlated to heating. More heat, more pain; less heat, less pain. Spray mode is actually supporting a way in which our patients are actually not feeling too much heat, and the overall treatment is actually becoming really well tolerable. Try to enter slowly the cold peel technique. Cold peel is actually using the spray mode together with a colder ablation pulse. As previously described, H pulse is very cold ablating, still coagulating, we're talking about a CO2 device, but not leaving a thermal profile as relevant as smart pulse and deca pulse might do. Actually, it's a fractional ablative treatment. The thermal damage provided with cold peel is really minimal. The downtime is very minimal to total no downtime here, and in this moment is actually exclusive to the Smartxide Punto. Thanks to the material that very kindly Dr. Tanghetti from USA transmitted to us, we might see, depending on the different protocols that CoolPeel is offered by, with either 3, 4 and 5 watts, we might have different reactions actually either in the papillaris and reticularis dermis, depending on the different also intensity, which leads to almost no total 1 day downtime, just a few hours, up to less than 2 days and roughly 2 days. And differently, we might see the reaction of the skin, the different kind of stimulation, and the different kind of collagen shrinkage. This is also telling us that CoolPeel is not just a cosmetic treatment itself, but as you can see here, it contributes to a very important collagen shrinkage, because HP, it's a very energetic pulse. This is how, as a sort of confrontation and a sort of confirmation, what we might have in the case that I'm going to increase the power up to 8 watts. 8 watts in this case is out of the protocol of CoolPeel, honestly speaking, but it gave us the final confirmation of my previous assumption. And depending also on the different level of power that I use, the energy per single pulse is increasing, and as well is increased the depth of action of the laser. Which kind of ablation to use during the CoolPeel application? We might use all the offer ablation figure from the machine. They are pretty selectable in kind, size and compression from the scanner that is provided with Smartxide Punto. The tolerability from the patient standpoint is definitely great. There's no problem of pain during the treatment. The treatment, we can say, is almost totally painless. It's a very fast treatment. How long does it take? It takes kind of 5 to 10 minutes, and it represents a valid alternative of complementary combination with other treatments. Where shall I have CoolPeel? May I use it in other device from DECA? In this moment in time, unfortunately, and from a marketing choice, CoolPeel is available also on only on Smartxide Punto, because endorses the use of both spray and HP simultaneously. Smartxide Punto has been a very successful treatment. In the whole United States, there's no day in which people are not talking about this revolutionary technique that founds its history in what it was in the 90s, the launch peeling from other simpler cosmetic technique, but it found the basis in a solid tradition of CO2 technique and history from DECA company. Most of the top magazines are talking about the treatment, but also even the web, with very criticizing websites like realself.com, in which all of the patients are truly revealing their experience with all of the machine from this cosmetic and surgical scenario. You might find only good words about this revolutionary technique. It's very well welcome from the international patients community, and since there's no side effect, either downtime for most of the times, CoolPeel is actually the key to enter again the CO2 market in the right way, and revolutionizing what it was the use of a product that due to the downtime and due to probably lower technological values in the pulse, it was kindly abandoned. Just a few results of what we might see immediately. That's the before treatment, and then you can see there's a sort of lining of the whole face. up to and immediately after treatment, again, in a sort of similar scenario. We have a complete skin peeling and regeneration, as well as lightening in some of the cases of the tissue. As you saw before, I may have a different approach and go a little bit deeper using different level of power and have up to a 3-day progressions with a very mild redness after 24 hours and then a very high quality results after 72 hours. If I increase my approach, I might have even more severe redness immediately after, but then the results is definitely remarkable. I might have a faster treatment. I don't want to have any downtime, so I might be using the lower parameters, including 3 watts, so that I might have an incredible skin resurfacing even a week after. This is a 7-day post-treatment with a 4 watts. That is the median of the cool peel protocol. The cool peel protocol is actually including, as you saw before, 3 to 4 to 5 watts, 600 spacing, H-pulse, and stack 1 for who is actually more experienced with the stack functions. Last picture for Dr. Stromstein, the United States, includes a set of little bit more redness here, especially using 5 watts cool peel. For any further information, you may contact DECA at the usual numbers or deca@exp@deca.it. Thank you very much for your attention and see you next time.